Hi, this is Randy. I wanted to share a little bit of a perspective on therapy. There's so many people out there in the community that have been invalidated and disappointed and have felt ripped off by therapists, and they had certain expectations about what a therapist would do for them, what therapy would be, how much of the actual cost of a insurance paid session that the therapist actually gets versus how much the office or the organization that they are linked up with gets. So an insurance accepting agency or therapy office makes deals with people who have licenses and are credentialed to do therapy, and they either take 50-50 split or a 60-40 split, meaning the therapist gets 40% and they get 60. There's worse splits than that. And in community mental health agencies where there's sliding scales, that therapist just works on an hourly basis. They may make $20 an hour, and the insurance company is charging, whatever they charge based on whatever that person's insurance is. And the office just gives the therapist a flat fee. Then I would like you to consider that a therapist that is going to do individual therapy for 20 to 40 hours a week would need to remain present for an entire, if it was 40 hours a week, it would be 8 hours a day. 8 clients a day. Most of them aren't going to take that many because it's too difficult. So they might take 4 to 6 clients a day. Okay, so that's remaining completely present throughout 6 hours with maybe a 10-minute break in between or a 5-minute break in between clients. And then you get up and do it the next day. I mean, do you guys think that's simple? To listen and kind of rack your brains and try to help in the best way that you can for that many hours a day, week upon week, year upon year. I'm just trying to put it in perspective. I'm trying to get people to empathize with a position of a therapist and with the job of a therapist. Would you be able to do it? Listen, remember, concentrate, be present, one-on-one for that many hours a week. I know I wouldn't, so I don't attempt it. I would never attempt to do that. Okay, that's number 1. Number 2, who goes to therapy? Well, when you're under 18, you pretty much can't go unless you're referred by the school or your parents send you there. Most of the time, you're a teenager, your parents send you there. Most kids don't want to go. Some do. But when you get sent by somebody else and it wasn't your idea, it doesn't really work out too well. Same with adults. Other adults that go to therapy regularly are ones that are court ordered. Again, when you're court ordered to therapy, a lot of times you're not really into being there because somebody's basically forcing you to go. Same with marriage counseling. A lot of times one of the spouses is pressuring the other one to go. It really wasn't their idea. And so they're just kind of going along with it. They're not all in. If it wasn't their idea, the way they come in with an attitude to a therapist is kind of like a skeptic comes into to an attitude with a psychic when they sit down and, you know, say, "Oh, you're gonna tell me my future? You're gonna read my palms?" That's the kind of attitude people who come into therapy and it wasn't even their idea. They've just been sent there. That's the attitude they have. And when you have that kind of attitude, it lowers the chances that you're going to be successful. Okay, so now let's get to those adults who do go to therapy. Well, as we can see, look out into the world, we can all see there's a lot of people who need to go who never went yet. You get to a point in your life, you finally get to a point in your life where your basic needs are pretty much being met, and now you need to figure stuff out. Most people first go to self-help books. Other people go just to the medical doctor. They decide what kind of medicine they think they need, and medical doctors will prescribe things that they really don't have any business prescribing, but since they're allowed to, and their patient comes in with a certain complaint and demands, I saw such and such on TV, so I don't want to go to a psychiatrist. You're my medical doctor. I have trouble sleeping. I heard Ambien's good. Can I have some of that? Or, I have sexual problems. I heard Viagra's good. Can I have some of that? I mean, that medical doctor doesn't know crap about what's going on in the person's personal life. So a lot of people just go to medical doctors, bypass the therapy, and get the drug. And it's perfectly legal. So if you end up in that category where you decide, note that I need to go to talk therapy and I want to change, I've tried self-help books, I have gotten some medication, but, I have insurance or I can afford to now really give myself this gift and go to therapy. So what do you really know about therapy, about therapists? Do you think they're all the same? Because I'm going to read to you a random list of therapists in Minnesota by specialty. A lot of times what the general public does not know is that therapists specialize in different areas. Human behavior and the study of it and psychology is way too big of a field to expect any one person to be an expert in every single area. The general public doesn't think about this. Here is some areas of specialty for therapists. So if you get a therapist that specializes, they're probably going to be, better in that area, and they're going to know less about all other areas. When you get a client sitting in front of you, your specialty is addictions, let's say, and your client ends up having symptoms of anorexia and bulimia. As a therapist, you're not supposed to continue to see that person. You're supposed to refer them to somebody who understands anorexia and bulimia, because you know you don't, and you're not going to even try to act like you do. Alright, so here's this list randomly. Therapists in Minneapolis, Minnesota, by specialty. Here's the different kinds of specialties. Addictions, adoption and foster care, aging, anger management, anxiety and panic disorders, Asperger's syndrome, attachment disorders, attention deficit hyperactivity disorder, autism spectrum, behavioral problems, bipolar disorders, career and employment concerns, child abuse and neglect, couples or marital issues, depression, developmental disabilities, dissociative disorders, domestic violence, dual diagnosis. So now people who have substance abuse and another disorder. That's usually what began as dual diagnosis. When they said dual diagnosis, they usually meant when people have a combination of substance abuse on one and then something else. Eating disorders, education, personal development, elder abuse, factitious disorders like Munchausen syndrome by proxy. Yikes. Okay, so that one might be that specialty would be somebody who may know something about the cluster Bs. FYI. Family issues, fire setting therapy, forensic therapy. Okay, forensic people will know something about sociopaths and antisocial personality disorder. But you as the client, you're depressed. So you wouldn't think to go to a forensic psychologist to talk about your narcissist, to find somebody who understands the sociopath or psychopath in your life. You would think I'll find somebody for depression, or first you usually think I'm going to find somebody for trauma and narcissistic abuse, and then when you try them and they haven't heard of it, maybe you want to go get treated for depression. But you would never think to go to a forensic psychologist because you're the presenting patient and you're not a criminal. But you want people to understand how you were basically abused by a criminal. I'm just saying. Put yourself in the therapist's place. Put yourself in the field. Understand a perspective here. I'm going to continue listing the different specialties. Gender identity therapy, grief loss therapy, immigration or newcomer therapy, infant mental health, infertility therapy, interpersonal relationships, learning disables, life transitions, medication management, men's issues, multicultural issues, neurological therapy, obsessive compulsive disorder, pain management, parenting issues, personality disorders. There's a good one. Phobias, physical illness, postpartum depression, pregnancy and childbirth therapy, psychosis and major mental illness therapy, psychosomatic therapy, runaways therapy, self-abuse therapy, sensory processing disorder, sexual abuse, rape therapy, sexual disorders therapy, sexual orientation therapy, sexuality issues therapy, sleep disorders, religious concerns, stress therapy, suicidal thoughts therapy, Tourette's disorder, trauma PTSD therapy, traumatic brain injury therapy, and women's issues. Thank you.